Hey everyone, Dr. Andrew Orr here. I just thought I'd come on and talk about part two of to do with surgical intervention and what to do afterwards. As I was sharing in part one of my story, actually, just my recent story of actually having my eighth surgery, I thought it was really, really important to come on and talk about the importance of surgical intervention because I know a lot of people put it off. And a lot of people will look for everything but what they need to be doing. And I can understand it. It's surgery and, it's scary and, no one wants to go and have it. But look, there's a point, as I said, when you get to a point with pain, where medications, where everything you're doing is not working, then the only thing you really have left is surgical intervention. And sometimes like in my case, where there's a structural issue going on and there's adhesions and all kinds of stuff, you just have to go in there. And the other part is, as I've always said, you need to see an advanced trained surgeon, especially for women with endometriosis and women's health issues and, advanced disease states in the pelvis. And the problem is most people haven't seen one, and that's the reality. And as I said, it's not a slight on anyone. It's just that every profession we have, as I said, they're the top level. And unfortunately, like every profession, we've got stages underneath, and these guys are the top of the best of the best. And there's also ones that just specialize in things like endometriosis, or like in my case, specialize in a certain procedure that I had to have done, which took 3 hours, which is extensive. But I also know that some of my advanced trained surgeons, when they go in for endometriosis, they'll spend hours in there too, because they want to do the job properly. Whereas a normal, just a quick look laparoscopy, as I call them, it's about half an hour and they're done and out. And it's not enough, but these guys can do intricate surgery. They are, the best of the best. There's no one better than them. Often people ask me, how do we find out about these people and why aren't they advertised? And I'll let you know, they're not allowed to advertise. There's strict laws around advertising as a healthcare professional, and you're not allowed to be seen as anti-competitive, because let's face it, these guys put all that up there, they'd be seen as the best, no one see anyone else. So they're not allowed to. There's strict laws around advertising, as I said. And yeah, it sucks, but that's just how it is. We have to follow it. And people say, well, how do I find out about it? Well, that's where people need to come to see practitioners like myself or other healthcare professionals that know who these people are, and then can refer you to them. So in my network, so I've set up the experts program. The only surgeons that are a part of the experts program are advanced trained laparoscopic surgeons or advanced trained surgeons. So that's what we have. People ask, about public and things like that. Unfortunately, I'm sorry, but a lot of you that go through the public are only just going to get a trainee. And that's reality. They're training hospitals. You could end up having 6 operations compared to someone that would probably just have 1 operation with a private gyno, because it's all about training the surgeons. How else do they get trained? You've got someone who's a trainee working on you, and this is where all the issues at hand. But if that's all you have, then that's all you have. And that's all you have to go with. And unfortunately, that's just how it is. It's not likely that an advanced trained surgeon is going to be in the public system either. And the ones that are there training, you're not going to get to see them unless you've seen them as a private patient, and they might put you on their public waiting list where they will see you themselves. But that could take years as well. Public waiting lists are long. But if you just turn up on a public waiting list, you're not going to get to see those people. You just get given who you're given. That's part of being the public system. But at the same time, we have to be very grateful that we do have a public system where you can go and get surgery and things like that, because there's other parts of the world that you can't. Again, it might not be the right surgery, but at least you can get some surgery and you can get some level of care and things like that. Anyway, it's a big issue. I've talked about it many times on other videos and stuff like that. So I want to get on to the next part. Is the important part is post-surgical care. Now, a lot of people think that surgery is the optimum. That's it. You have the surgery and it's done. Well, if you think that, pretty naive, as I say to people, and I'm sorry if that's what's happened, but that's what a lot of people happens to a lot of people. And they have the surgery and then do nothing. Now, you have to be real about it. For things like, say, endometriosis, you're going to need progestin therapy afterwards, regardless of what people tell you, your personal opinions, all the kinds of things that go with all the things I see, that all the excuses people give me and say what they do and don't want to do based on their Dr. Google search. The problem with that is there's a lot of misinformation out there, and as a healthcare professional, it frustrates the hell out of me sometimes. But then again, I see things happening within the health system that frustrate the hell out of me too. So I see it both ways, and that's where I have a unique view to look at things. But I often have to sit people down and say, look, you've got to look at the facts. You've got endometriosis or you've got adenomyosis. They're both driven by estrogen. So they're driven by estrogen, and progesterone helps suppress the disease further expression. So what do you think you're going to have to take? Oh, but I don't want to take that. Well, if you don't want to take it, then that's your choice and you have to live with that. But you have to understand that the disease is going to grow back. It'll grow back a lot quicker and you'll end up having more surgery. That's just how it is. But what if I take this, this, and this? Yes, there are other things you can take to help, things like herbal medicines alongside medical interventions, but they're not progestins. They don't have a progesterone acting effect. The way that herbal medicines and things work is, yes, they help balance hormones, but they're not putting hormones into your system. With progestins, it's putting a hormone into your system to regulate and suppress. So with herbal medicines, I tell people it's more working on things like your microcirculation, and it works on a totally different pathway. Yes, it can act on pituitary function to help regulate things, but it's not topping up something, or like a progestin, you're putting hormone replacement in. Basically, it's all hormone replacement therapy, really. It's all HRT. It's just when you say the word HRT, people think menopause, but it's all hormone replacement. It's same when I talk to people about the marina, they go, oh yeah, but I'm getting all this systemic stuff. Oh, it makes me feel this and makes me feel that. It doesn't work like that. It's a very tiny little device that's got a tiny amount of progestins in it, and it's got to last 5 years. So I often say to people, how much progesterone do you think those things have got in them? It's got stuff all. It just acts locally enough to stop implantation for pregnancies and things like that. Just a minute amount, but it's such a minute amount that it just acts locally. So you've got to look at all those things. So people often there's a lot of misinformation that I'd like to get out there. I'm going to do a whole post on just progestins and contraceptives and things like that in another post. So we'll talk, so we don't get caught up on it. So that's the other part. And then the other part is all the other management that you need to do after a surgery, like I've had to do. So I've had to go home from day one, flush out my nose, one, because the doctor said I needed to. And I know I needed to too, because there's blood and gunk and leftover yucky stuff up there. And that all gets back to why I say to people when they don't want to go and have surgery, like me, leading up to my surgery, I got to a point where I was tired all the time. I wasn't functioning properly. I was functioning enough to go to work, do what I need to do, go home, and then I'd crash. And then some days I'd be great and go for days where I was really, really good. And then, you know, some weekends I'd just crash and I couldn't talk to people. People were stringing all sorts of things, you know, projections and that. And why haven't you returned my call? Blah, blah. I'm like, I'm laid up in bed. And really, when the surgery came about, as the surgeon said to me, he said, mate, you got a head full of pus, you got a head full of infection, you got a head full of adhesions, you got a head full of scar tissue. It's not draining, and anything that's draining into your stomach, and you're just seeping poison into you. So how do you think you're going to feel? And he says, I'm surprised you got this far. And I remember, because my surgeon is different to my ear, nose and throat specialist, my ENT, who is the best guy ever, said to me, he said, I can't do surgery because I'm not the advanced trained surgeon. He said, I can just do what you've had done for the seven other operations. He said, that's what I do. But what you need is this. So I'm thankful that he actually said that, and I explained to him how I explained to my patients how we need advanced trained surgeons for endometriosis and other things in the pelvis. He said, yeah, that's exactly right. But I'm not an advanced trained surgeon. He does those surgeries day in, day out. He's the top of his field. So go down and see him. He's a mate of mine. And that's the difference between other parts of the medical profession too. They inter-refer and they know their limitations, whereas other parts of medicine, they don't want to refer because they're scared of losing a patient and all that. It's stupid. It's what they should do. But like I said, you know, this is what we see with a lot of women. They've got a pelvis full of endometriosis. They've got cysts. They've got adhesions. Adhesions is really like, it's inflammation. It's pure inflammation that's taken the form in a webbing. And then some of them have got pus and God knows what going. They're inflamed to hell. And they come in and they're going, but why do I feel like this? Well, because you've got a pelvis full of inflammation and your gut's inflamed and it's making your brain stop, whereas mine was all in my brain here anyway. But it's the same process. It doesn't matter where it started. It doesn't matter what the disease is. It's all inflammation. And the more inflammation you have in your system, the more pain you're going to get, the sicker you're going to feel, the more fatigued you're going to feel, and all that. So it's hard when we see people with sores like systemic infections. We know they have to be cut because that pus can turn gangrenous and things like that, and it gets into the system and they poison the whole bloodstream. Well, that's the same sort of thing, really, not quite on that extent, but you've got this low-level infection that's sort of poisoning you. And that's why you need to do the post-surgery treatment. So this is where it all gets back to again. For me, flushing, I had to take some steroids, I had to take some antibiotics, and then I've got to continue flushing each day. And now that the sinuses are opened up and widened after my 3-hour drilling in there to get them wider so that things can get up there and then drain out properly now, I'm going to be a different person. So now I'm starting to feel a lot better. And that's what I say to my patients is that if you do the proper management, it's not just have the surgery and then you don't do anything. So those that have women's health issues like endo or PCOS, you might need ovarian drilling, you might need to, well, one, you will, if you've got PCOS, and even endometriosis, you've got to get your diet, lifestyle, all that under wraps. You've got to get your microbiome, because the microbiome is the center of your immune system. It helps drop down inflammation in the body. You might need to see a pelvic floor physiotherapist because you've got pain in the pelvis. There's now procedures that while you're under, you can have nerve blocks, Botox and stuff like that into the pelvic floor. While you're there, you might have to have a cystoscopy to have a look inside your bladder to see if there's something going on there, and you might need to be managed because you might actually have another disease state like interstitial cystitis and think it's endometriosis, but it's really your bladder and your pelvic floor and all that firing off. It's not the endometriosis at all. Sure, the endo exacerbates it, but that's what I mean. So then after the surgery, it could mean you might have to be, for women with things like endo and adeno and all that, means you will have to be on some form of progesterone therapy. And how you do that and what your choice of progesterone in is up to you. There's even bioidentical hormones now, bioidentical progesterones and stuff like that in forms of cream. They work a little bit differently and they're not as strong, but they are some form of progestin, and there's some good evidence around them. But again, you need to talk to your specialist or healthcare practitioner about what best options are for you. And that's what a good specialist should do. Then you can talk about things like herbal medicines and other things like that. But again, they have to be used alongside medical interventions, and they can assist alongside medical interventions and can be used concurrently. They work in different pathways and stuff like that. But again, talk to a healthcare practitioner. And if your medical practitioner doesn't know, then talk to someone that has experience in complementary medicines and is an expert in complementary medicines and knows what they're doing, because not everyone, same with natural medicine, not everyone's an expert, not everyone's done postgraduate experience, and there's a lot of untrained people out there, and you're seeing them thinking they're an expert and they're not. Same thing, both goes on both sides of medicine. That's why, again, we've set up the experts program. So it's looking at all that, and you've got to be real, and you've got to look at how your emotions are affecting you, because let's face it, if you've got high anxiety, you've got PMDD, you've got depression, you know, all that kind of stuff going on. Anxiety is the biggest fuel of a lot of pain issues and exacerbates a lot of pain issues. So mental health is crucial, and why all my patients see a psychologist and are recommended, and why I always look at the emotions. It's one of the first things we look at, and they get depression, anxiety, stress scores to fill out so we can see where they're at. So it's all about that, managing, you know, psychologists, you know, downloading things like the Calm apps and all that. As I said, they might need to see a pelvic floor physio. They might need to do pelvic floor work. They need to work in with their GP as well, because the GP needs to be kept in the loop. So it's about that multi-modality of team approach. So it just doesn't stop just because of surgery. So if you're going to just have surgery and then not do anything about it, and there's no follow-up, you're going to be back to square one, and back to square one very, very quickly. You'll probably get 6 to 12 months out of your surgical intervention, and then that's it. So the more that you do, the more it slows down the progression of your disease, the more it slows down your pain, and then you're managed with proper medications like pain medications and monitored properly, rather than self-prescribing to yourself, because a lot of people do. And we do have a lot of people that are narcotic dependent, and they're drug dependent, and they're prescription junkies sitting at home. Now, that's not judging them, because let's face it, when you're in pain, like I have been, the only thing that's going to get you out of pain is pain medications, and they are much needed, but some of them are addictive. They're very addictive. You have to be very, 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 very careful. And they have long-term side effects and short-term side effects, and you have to be careful of what those side effects are. And this is where careful monitoring and doing things that can reduce your reliance on pain medications is really important. And I've talked about this in many other videos, because you need to reduce your pain medications. And if you're at a point where you're increasing them and nothing's working, that's when you need to have interventions. Again, sitting at home, posting in groups and asking for help in groups is not going to help you. It doesn't. It really doesn't. Those people are untrained. They don't know what to do. They can only go on past experience. They can only go on what they know, and that is generally stuff all. I'm sorry, but that is true. They don't have the medical background to know exactly how to manage you properly. Sure, when you've got a disease, you know how to treat yourself and you know what you need to do, but that's you. And that's the other part I need to get to, is that we all might have a certain disease state or a label. And this is why I tell people, don't buy into the label, because everyone, no matter, say you have endometriosis, we could put 10 women in a room, you might have similar symptoms, just remember, some women don't have any symptoms at all. They're actually asymptomatic. Or adenomyosis or something like that, or PCOS. We could put you all in a room. Could have different symptoms, and you're all individuals. So you have to be treated as an individual and prescribed individual treatments for you. And what works for you might not work for someone else. Look, there's some people, like we screen, some people can't take certain medications. We do pharmacogenomic testing where we test them for certain medications where they can and can't take because they metabolize them too fast. Whereas the next person says, yeah, I'm fine. I have my codeine and blah, 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 and I'm fine. But the next person might react to it. So it's about looking at the individual, and you have to then work with your healthcare practitioner who should steer you in the right direction, like my ENT did. And I've got a fantastic GP. And having a healthcare background, I can look at things too, but I always see someone. I don't manage myself. I don't manage any of my medicines myself. I don't manage any of my treatments myself. I leave it to a healthcare professional because I could get it wrong and I could have a lot of bias in there. And when you're trying to do things yourself, you put personal opinion and everything in there too. So you can't do that. And as just a lay person, a general lay person, honestly, without the education, you really don't know how bad some of these disease states can end up if you're not managed properly. And again, some of the real side effects of medications that people pop like lollies if you don't have it managed properly. Same with herbal medicines, over-the-counter medicines and all that too. Same stuff. Just because we can get them over the counter doesn't mean they're not dangerous. They are. They're medications and they can cause a lot of things. For example, iron tablets. If you were to swallow a whole heap of iron tablets, you'd be really, really sick. And if a child gets them, they could die because a whole heap of iron into the system. So it's about looking at things and being managed properly. So it's a managed approach. So please don't ever think that you just have the surgery, it's done and dusted and you don't do anything. That's not how it works. As soon as the surgery is done, you should have a proper management, and it's all about the management, which is the real work to be done afterwards. All right, I hope that it's explained it all to you. The reason I'm again saying this to you after is coming from a place from me sharing with you a recent surgical experience, and it brings a highlight to why it's so important and how much benefit you can get out of it. Like I say to people, for 3 years I haven't been able to smell, haven't been able to taste, and now with the surgery I can start to smell, and with the post-surgical treatment I can now not having headaches constantly, I'm not as tired, my smell's coming back more and more each day, my taste is coming back more and more each day, and to actually smell the rain for the first time in 3 or 4 years, it's quite overwhelming, and I can smell food and things like that. So it's the same for you guys. It doesn't matter what disease you have. If you're managed properly, all your symptoms can be resolved and you can start to get your life back. You can. And I will argue with anyone constructively, not for the sake of being angry or anything. I mean, constructive argument about the importance of proper management post-surgical care. So that's why I'm here. I want to help people, and I want to help you and whoever else is out there. And if you do need help, you can always find me. You know where to find me. Call my staff and they'll be able to help you and see how I can assist you. And that's what I'm here to do, because I want to guide people to get the best care possible. All right, I will see you later. Remember, keep your chins up, and there's always help out there. But part of any help is you initiating it and doing the work, and that's how you get better. All right, take care.